So let's say you are someone who is doing your exercises exactly as prescribed. You're doing your strength training, you're doing your stretching. Maybe your therapist is really focused on walking speed and distance, and your walking speed is improving, your walking distance is improving, but you still feel like there's a disconnect between all the things that you know you should be doing and are doing and the actual real world. In other words, you still feel a little bit off balance when you're out in public, and you definitely don't like uncertainty or unfamiliar situations. If so, then this video is for you. Because in today's video, we are going to go over what potentially is the missing link in most rehab protocols, and that is plyometrics. So in this video, I'm going to give you a little bit of information as to what happens to your brain and your body after a stroke, what plyometric exercises are, and how they might be a valuable missing link in the current stroke rehab protocol, and of course, exercises that you can start doing today to start bridging the gap between all the things you're doing in therapy and actually being able to apply those drills into the real world, i.e. walk with greater confidence, greater efficiency, and less thinking, which will absolutely improve your overall quality of life. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset with the end goal of empowering you with as many tools as possible to take full ownership of your rehab and your overall health. So first, let's just talk about what happens after a stroke. Now, most people think you lose strength because that's what you can see. So you have a stroke or you have some kind of damage to your brain. Most of you know this, especially if you've been watching this channel for a while. Simplified, you kind of wipe out one of those neural circuits that helps to control movement. And what this looks like is a weak arm or a weak leg. Then for most of you, hopefully you fall into this category. After a little bit of time, you start to see the arm or leg move again. So you feel like your strength is being restored, and that if you just keep strengthening it, it's going to keep building, and voila, you're going to be back to your old self, performing all of the seemingly simple tasks again like you were doing before your stroke. But that's not actually what's going on when you're starting to see that limb move again. But more importantly, our muscles do a whole lot more than just contract, meaning that there's a whole lot more that goes into walking and moving around in our environment than just getting the muscles strong again. There's timing. We have what we call normal synergies, where muscles link up together to make us more efficient. So normal synergies would be like when you see elite athletes. I watch a lot of gymnastics, so I always use that as an example, but you see them do these amazing skills, right? They've done so many drills, they're not really thinking anymore because they have a whole lot more built in like normal synergies. They're muscles that are linked up together, so they don't have to think, okay, jump off the floor, now tuck in, and now flip my body over, right? They have some shortcut codes that just kind of kick in. We call those normal muscle synergies. All of that relies a lot on timing and some other built-in mechanisms in our system, which we'll go into when we start talking about plyometrics. But just know, just because you're getting your strength back after a stroke doesn't necessarily mean that you're getting all of these other components that are so essential to being able to move about our environment, i.e. walk, go up and down stairs, get on and off the floor, step over a curb, with as little thinking as possible. All that to say, long story short, some of the key things that you miss or that you potentially aren't getting back after a stroke is muscle timing, muscle modulation. Most of you know this. A lot of your muscles are either all or none. They either contract or they relax. And that's not really how our muscles work or how your muscles work before your stroke. We need that ability to modulate our muscles. We lose muscle power, and muscle power is how quickly a muscle can contract. And we lose some muscle reflexes that are beneficial for maintaining a little bit of stiffness in our muscles to allow us to react to unfamiliar situations or unfamiliar movements quickly to either prevent us from falling or prevent us from getting injured. All of that soup that is really, really important to normal movement can potentially become impaired after a stroke. So that brings us to plyometric exercises. What are plyometrics? Plyometrics are challenging our muscles to quickly lengthen and contract by tapping into something that we call the stretch-shortening cycle. So what is the stretch-shortening cycle? It's just kind of a fancy way of describing a component of muscle performance where if you stretch a muscle really quickly, it'll respond by contracting really quickly. So if you think of a rubber band, when you stretch that rubber band, for those of you that want to a flashback to high school, you stretch that rubber band stores some potential energy. When you let go of that rubber band, you are releasing that kinetic energy. So why is this stretch shortening cycle, or this ability of that muscle to stretch, lengthen, and contract really quickly? Well, it's good to improve our ability to react to certain situations. So if we're falling really quickly, we get that immediate recoil contraction without necessarily needing to tap into like the brain being able to think about that, send the signal up to the brain and send the signal back down. It's just kind of a reaction that occurs right there in the muscle. So it makes us more efficient with less kind of cognitive load. And bigger picture, zooming out, plyometric type movements, they do just kind of help to maintain the health of muscles. So that'll be important as to why I think they are valuable exercises that many of you should be incorporating into your routine. Plyometric exercises have been used for a really long time when it comes to sports and elite level athletes for all the reasons I just mentioned, but they're now starting to do more research with, or they have been, with older adults and decreasing the risk of falls and maintaining overall health. And they're seeing some really good results in that area. So there's no doubt in my mind, and again, this is just opinion, that this is a critical type of exercise that should be incorporated into most stroke rehabilitation protocols. And if you've been around here for a while, you know I've been making videos on this for a while, so I've known this for quite some time and definitely incorporate them into the therapy sessions of my patients that I see in person. But why isn't this more broad scale? Meaning, why isn't this in more stroke rehab protocols? And the main reason is that I think a lot of the medical world or the healthcare community just has some limiting beliefs when it comes to what is possible with someone who's had a stroke. But the reality is there are a lot of people that can't do these types of plyometric exercises after a stroke because you don't have the strength or you're not like mobile enough. So I guess the research community just doesn't really see it as a viable option. And so they don't invest time into creating research studies for it. So again, my belief that it has a huge impact on stroke rehab is really just based on my clinical experience. And combine that with where I started this video, that a common misconception, not just among people that are recovering from a stroke, but also many, many clinicians or physical therapists specifically, is that we just need to make the muscles stronger. And so we kind of deviate down the road, or we kind of hyper focus down the road of just like rebuilding strength, not realizing that it's all these other components of the muscle that not only maintains muscle health, but is also critical when it comes to decreasing your risk of falling and improving your overall balance confidence. So now, why are plyometric exercises so hard to incorporate into a stroke rehabilitation program? Well, plyometrics, like I said, takes advantage of a rapid lengthening and shortening. So think of like a pogo stick or just bouncing in place. Jumping jacks would probably be considered another one of this type of plyometric exercise. Many people can't do that. However, if we think of the concept of plyometric exercises, there are absolutely ways that someone, even with low mobility, could perform these exercises. So, what is the main component of a plyometric exercise? A muscle quickly lengthens and shortens. Think of that rubber band. We're trying to get that rubber band motion. We want a very quick lengthening and a very rapid shortening with very little latency time between the lengthening and the shortening, meaning there's no pause or anything. It just quickly recoils back, right? So what are some ways we can do this? Well, one way we can do this that I've shown quite a bit on this channel is using a TheraBand and attaching it to a wall or overhead and just letting the band pull the leg up and then push it down, pull the leg up, and then you push your leg down. That's lengthening of the muscles on the back of the leg and then a quick shortening. So you're allowing that band to kind of help you create that kind of pogo or bouncing motion. The other way I love to do this is on a mini tramp. So you can just stand on a mini tramp, and with 2 feet on the mini tramp, you could just do little oscillations. Right now, that exercise in particular might seem scary to some of you, but so don't do it on your own. But in therapy, there's lots of ways to get someone onto a mini tramp that's really low level. And then you can put it inside parallel bars to make it very, very safe for someone. And then you're not jumping on the trampoline, you're taking advantage of the springs on that trampoline to start creating that pogo motion, right? A little bit of a soft knee bend is a little bit of a lengthening, short, lengthening, shortening, lengthening, shortening, right? That up and down, as long as you're giving with that, your knees. I love a mini tramp because not only that is it starts to, remember I told you at the very beginning, you also lose the coordination between muscles, and there's those normal muscle synergies that we get between muscles. In this situation on a mini tramp, you're learning how to coordinate your ankle muscles with your knee and your hip muscles. So that's why I love it, is it's not only like helping to rebuild that stretch lengthening cycle within a muscle, but it's also getting groups of muscles to work together. So that's another way that I love to incorporate this type of a plyometric exercise into someone's routine. And then for those of you that are higher level, you can do it on one leg, making it even a little bit more challenging on that mini tramp and setting the other foot on a box or a chair or something just to get your uninvolved leg out of the way. And then for those of you that are even higher level, we would take it to standing. And again, you can use a TheraBand to assist in this situation as well. Remember, it is very similar to a rubber band, what we're trying to get that muscle to do. So TheraBands work out great to assist with plyometric exercises. And you can just do little pogo jumps with a TheraBand attached to a wall to start. And then once you get good at that, you can do those pogo jumps on the ground, just on the regular ground. If you get good at that, you can try doing it with your feet in different positions, like staggered position, which is one that I really like. All of those are absolutely possible for the majority of people that have had a stroke. Now, if you've had a stroke, I don't recommend you do any of these exercises on your own. I definitely recommend that you work with a therapist who understands how to grade an activity appropriately based on their assessment of you and where you're at in the recovery process. That's really, really important. And no, I've said this a few times in a few recent videos. I don't necessarily think it needs to be like a neurologic physical therapist. And in fact, I do think many, many neurologic physical therapists are almost have some limiting beliefs around these things, whereas an orthopedic therapist, and again, just my opinion, because I have a lot of friends that are orthopedic physical therapists, their ability to kind of think outside the box and challenge you in an appropriate way, I almost feel like based on their experiences of working with a lot of different athletes and kids, because a lot of them, a lot of orthopedic physical therapists work with like teenagers and they work with the elderly. So their ability to work with all of those different age groups of people, I sometimes feel like their experience might be better. Now, the downside is some orthopedic physical therapists are just kind of like siloed, like they feel like that's the only condition that they can work with, and they don't think open-minded of how they can take those skills and apply them to someone who's maybe lower level. But in my experience and in my opinion of just working with both types of therapists over the years, I do feel like if you have an orthopedic therapist who's willing to learn and think outside the box a little bit, their whole thought process might be better if you're someone that's in this category of wanting to challenge yourself in this area, again, to improve your overall balance and your overall balance confidence. But most of you don't have, from what I see in the comments and the emails, you don't really have a neurologic physical therapist in your area. So the reason I'm mentioning all of this is I don't necessarily think you need a neurologic physical therapist. And in fact, I think some neurologic physical therapists might even hold you back. So don't rule out looking for a good orthopedic clinic near your home. Now, given all that and how there's very little evidence that supports plyometric exercises for patients that have had a stroke, I did find one study that I was super excited about that was published in 2025. And I saw this study and I was like, this is it. This is what I'm going to base my next video on. This is going to give me all the answers. And I read the abstract, and the conclusion was cherry-picked by me a little bit because it aligned with what I already believed to be true based on what I've seen over the past 22 years when I incorporate plyometric exercises into someone's routine. But I thought this study is finally going to back up or give the evidence to support what I've known to be true forever until I read the study. And this brings up a whole nother can of worms that I'll probably make a video on someday. But this study completely missed the mark, although it had the conclusion that supported my belief system, which I fully understand is a bias, but I definitely was very, very interested and very much wanted to have this study fit in to what I already believed to be true. And it did in the conclusion, but what was so heartbreaking about this study is it's not even the intervention was not even plyometric exercises. So why do I tell you all that? So what did they have people do in this study? In the experimental group, the plyometric group, they had people doing like fast sit to stands, which is not a plyometric exercise. So I'm very disappointed that the study needs to be done, but the intervention was completely wrong. So why do I tell you all this is, first of all, if you're a clinician, make sure you read the study and you're not just reading the conclusion and telling patients something based on a conclusion you're making based on a study that is not even remotely testing what you want to test. Like a fast sit to stand is not a plyometric exercise. I will link the article in the description below, but that's not a plyometric exercise. So to say that a plyometric exercise improves someone's overall balance, confidence, or decrease their risk of falls based on this study is not even true. But the other thing that's disheartening about this study is they didn't think that, I believe, I'm just making an assumption here, they did not believe that someone that's had a stroke could actually do a plyometric type of exercise, like a little pogo jump or a little mini box jump where you jump off the box and then you jump back up onto the box. Like they didn't have anything like that. And even the exercises that they did non-weight bearing, which I do some, that band exercise I mentioned earlier is one, even the exercises that they did that were non-weight bearing are not, they're concentric eccentric. And that's exactly how they described the exercise. They did a concentric with an eccentric, and that's not taking advantage of the stretch shortening cycle. So I wasn't going to include the article in this video because once I read the intervention, I realized it wasn't a plyometric exercise. I didn't think it really mattered. But the reason I'm bringing this up for all of you guys is you really can't take evidence-based recommendations from me or from anyone else. I have my biases and I have my opinions. You know, no human is totally immune to that. The best thing you can do is when someone does give you information, ask for the source and maybe read through those articles on your own to see, does this apply to me? Where do I see this the most is all of the clinicians out there that still tell people that you can't make progress after 18 months, which is absolutely not true. And so when a clinician tells you that, I would ask them, where is your source? Can I read it for myself? And you go through and read that. Is that true for some people? Absolutely. Totally off tangent. But who is that true for? Potentially someone who has a very, very severe stroke, right? Or someone who has a stroke on one side of their brain is going to be very, very different from someone who has a stroke on the other side of the brain. So someone with a stroke on the right side of the brain might have more difficulty attending to an activity. Someone that has a stroke on the left side of their brain has no difficulty attending to an activity, potentially, right? But that's one huge example where you're comparing apples and oranges and you're putting them both in the same study and you're saying, see, we did this exercise on all of these patients that their stroke was 2+ years ago and there was no improvement. Well, you're putting way too many people into that study. The inclusion criteria needs to be a little bit more restricted. That's just another example of therapists, clinicians, and me included, but hopefully I'm getting better at this, that potentially might just skim an article or read the title of an article and draw a conclusion without actually reading the article. So just advice for all of you that really want to take full ownership of your rehab and your recovery is always ask for the source so you can read it for yourself to see, does this therapist's interpretation of this article include me? Am I included in that inclusion criteria or am I not? And then you can base an opinion as to whether or not you want to receive that information or not. So the two main points of this article or this video, one is to reaffirm my belief that plyometric exercises, taking advantage of that short lengthening, shortening cycle is super, super important. Two, many of you might not be doing that in your current physical therapy because of maybe some beliefs that therapists have adopted that maybe don't necessarily align with the current evidence, or maybe your therapist has some limiting beliefs where they don't believe that you have the ability to do some of these riskier activities. And hopefully you got some ideas of how you might be able to incorporate some plyometric exercises into your home exercise routine that you are doing on your own. I hope you guys found this video helpful. I hope you guys will give your experiences in the comments with traditional therapy, how you incorporate the exercises that you're getting from your therapist and how you're modifying them potentially or what you're adding to them if you think that they're adequate or if you think that they're missing some components. I also would love to see how many of you just go to therapy and you're just getting on a treadmill and working on walking speed. I still get a fair number of people that are in that category. But just share your experiences and then how you overcome some of those limitations based on therapists that are in your area to make sure that you have a well-rounded exercise program. Would love to hear your thoughts. Again, I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.